Good Monday morning to you all. I hope everybody has had a relaxing weekend. This is Dr. Kaveh Elahiun coming to you guys live from Optimal Care Wellness Clinic in Winnipeg, Manitoba. Today we are lucky to have Dr. Russell Kennedy with us. He's a medical doctor and neuroscientist, and also he calls himself a stress doctor too. So we will be dealing with some of the aspects of how stress and anxiety has adverse effect on our body, and basically how we can deal with it. So we will see if we can add Dr. Kennedy here. Perfect. Good morning, sir.
Hey, can you hear me?
Yes, I can hear you just fine. How are you?
I'm doing okay. I got a bit of a cold starting, but I think I'm okay otherwise. I was trying to get you here for the last 5 minutes, and I guess it just wasn't picking it up for whatever reason. So I think
Sometimes technology is a great thing, but unfortunately, when it doesn't work, it just doesn't work.
yeah, the laptop is not the best, I guess.
Everybody, this is Dr. Russell Kennedy. He's a medical doctor, neuroscientist, and we are glad that he could devote some time for our discussion today. So go ahead, Dr. Kennedy, give yourself the introduction, and we will dive right into it.
Okay. Well, I'm a medical doctor and a neuroscientist, studying anxiety specifically, and trying to find a different way of looking at anxiety because the treatments that we've got for it now clearly aren't that helpful. The long-term remission rates for psychotherapy are, at a year are not that great. CBT and that kind of thing is helpful in the short term because I do think it helps change your thinking patterns, but I think a lot of the anxiety that we hold is actually in our bodies. And when we hold this stuff in our bodies, our minds tend to go along with the same thing that we feel in our body. So if our body is feeling angst and fear and fight or flight, that goes up to the brain, and the brain's just a meaning-making, make-sense machine, and it says, hey, what's going on here? It feels like we're afraid. What are we afraid about? And then if it doesn't have an actual thing that you're afraid of in your immediate environment, it goes back into your past and then digs up your worst fears and then, portrays them to you in your thoughts, which of course creates more alarm in your body. And then this sort of alarm anxiety cycle starts. So my big theory is that a lot of anxiety is actually alarm that's stored in the body, usually from old trauma that's unresolved. And it just keeps reverberating through your mind. And all these therapies that go at trying to fix your mind are really missing the point. There's nothing wrong with mind-based therapies, absolutely. But you have to go with the body too. You have to go like, how do you feel this? How does it show up in your body? Can you breathe into it? Can you make friends with it? There's a lot of things that go on in the body that we can't explain as medical doctors. And I think we get sidetracked into reducing them down to like bodily functions in a way, and then giving medication to kind of treat the symptom rather than treat the underlying cause. So my thing is that I think a lot of anxiety, chronic anxiety especially, comes from not being able to connect with your body. Your mind and your body get disconnected. And then that disconnection becomes more and more pronounced as you get more anxious, and it just becomes a self-fulfilling prophecy or a vicious cycle. So that's, so my approach is to do both, is to understand what happened to you in your past, and to use the body as kind of a way of accessing those old programs that are stuck in you. So that's, in a nutshell, it's a bit of an odd theory, and I came upon it kind of by accident because I've dealt with anxiety for most of my life, and had some experience with some psychedelic medication that really showed me that, like LSD and ayahuasca, that really showed me that the anxiety that I felt was actually inside my body. It wasn't so much in my mind. So I've created this theory that let's go at the alarm in the body as well as the mental thoughts of the mind, rather than just sort of sitting in a therapist's office for an hour once a week and expecting that to fix you, because it won't. It'll help you in the short term, absolutely, but in the long term, the studies show that it's not really that effective long term. So that's basically in a nutshell with me with my cold medicine brain. And yeah, I guess you take what you can get today.
We're happy just you could be on with us. I'm quite honored to have you on. And these days, as I'm sure you see in your practice, that stress, anxiety, depression, they manifest themselves on many different ways when it comes physiologically
Yeah.
in our body. Could you please elaborate some on that?
Yeah, I mean, a lot of times I'll see people in their 40s, 50s, sometimes in their 60s, and it shows up in their body. You know, I've never seen a case of irritable bowel syndrome that didn't have childhood trauma. I've never seen a case of fibromyalgia that didn't have unresolved family trauma. So it's one of these things that shows up in our bodies. I mean, a lot of people say that the body is the unconscious mind. So after a while, you know, after your youth is kind of over, a lot of these things just will start to show up because we adopt these coping strategies, and worry is a coping strategy. Worry is a coping strategy that's trying to help us stay safe by constantly warning us of every possible thing that could go wrong. But in doing that, it creates a lot of this alarm in our system, and that alarm in our system wears our system out over the course of time. Cortisol, epinephrine, adrenaline, wears our system out after a while. And then the more our system gets worn down, the less likely it is to be able to feel better and combat the anxiety that's so it creates this vicious cycle of stress and then body pain a lot of the time, and then that stresses us out a lot more. It doesn't allow us to really get at the root problem and start dealing with therapies that actually do help the anxiety, that do help that feeling in the body, that do address that connection, that mind-body connection that we really, in medicine, we're not that great at dealing with. You know, we're learning, but in general, most MDs are not that versed in mind-body medicine. It's kind of like, this is where we're trained. It's a very pharmaceutical model. So I say, you know, if you're a hammer, everything looks like a nail. So if we're trained to treat things with medication, chances are that's what you're going to get. I did a Facebook Live a while ago about don't go into your family doctor expecting psychotherapy because we're not trained in it, for one. We only have 7 to 10 minutes with you. And, you know, what if someone does have a childhood where they were, say, you know, beaten by their dad when they were younger? You know, you're not going to deal with that in 7 or 10 minutes. You know, so chances are what you're going to get is an antidepressant prescription. And doctors want to help, so, you know, that's what they do. But often, you know, once the pain is numbed with an antidepressant, a lot of the times, you know, people don't want to go into it. They don't want to go into the old pain because it's too painful. And we hold these things in our body. And, you know, I do have this theory that we have these old traumas that are stored in our body. And because we don't want to go back into our body, we'd rather stay up in our head. So we'd rather do sort of talking therapy. And the other thing that we'd rather do is worry. So worry is a big distraction. If you've got a lot of pain, like emotional pain that is in your body, and so going into your body is uncomfortable, you're going to stay up in your head and worry and worry and worry, and worry becomes a distraction. So if the problem is down here and you're constantly up here, this is never going to get dealt with, ever. So you can make it feel better. You can develop, you know, thinking strategies to stop worrying and to look at the bright side and positive psychology and all that kind of thing. But unless you deal with the underlying source of that, you know, unresolved trauma that's held in the body, that's still gonna be a part of your system, and you're not gonna leave it too early unless you get some sort of specific therapy. Somatic experiencing, Hakomi are two ones that deal with the body, but both, you need to do both. I mean, Dan Siegel, who's an interpersonal neurobiologist, talks about creating a coherent narrative of what happened to you when you were younger. My father was schizophrenic, so, you know, I have this issue with him not being there for me, and that is lodged in my body. So once I dealt with that and got that kind of dealt with, a lot of the thoughts disappeared. So it's amazing how much stuff we hold in our bodies that just reflects through the mind. So one of the things that I like to say is, what if anxiety is more of a body problem that's reflected by the mind than a mind problem that's reflected in the body? Now, it's both, of course, but we're not doing anything to actually focus on the body, because that's where the source of the pain is. So we're kind of chasing our tail. So of course, people that go through psychotherapy for many, many years, who aren't getting better, maybe this pain is stored in your body and you're going at the wrong place.
Well, I have seen a few clips on YouTube that you have, and it specifically has to do with trying to control your anxiety and trying to basically deal with your mental anxiousness, I should say.
Yeah.
Give us some of the strategies that you use and you recommend to patients, especially when you see people telling you, "Doc, I just can't stop thinking. My
Right.
mind doesn't shut off."
Right. So what you have to do is one of my things that I love to say is that you can't beat thoughts on their own turf. You can't beat thoughts with more thoughts. Like they will always beat you. They're better at it than you are. You're not going to beat thoughts on their own turf. So what I do suggest is go when you're anxious, put your hand on your chest, rub your fingers together, rub your hands together, get some sort of sensation going, because what sensation will do is it takes some of that energy that your mind's been using to just overthink and worry and just create more and more thoughts, and puts you in a sensation. The other thing that sensation will do is it will pull you into the moment, because all anxious thoughts are about the future. All of them are. So if you know and you stay in the moment, like one of the things that I get my patients to do all the time is say, am I safe in this moment? They may be worried about a public speech they have to make in a week, or an exam they have to write, or a medical biopsy, that the results that are coming back. But, in that moment, are you safe? Like, are you safe right now in this moment? Are you safe? And just knowing that, and because a lot of my anxious patients have never felt safe. They've just leapfrogged from one trauma to the next. So they'll worry about something, and then that worry doesn't happen, and then they just jump to the next worry, rather than sort of realize, hey, and stay in that feeling of feeling safe, because that's what will train your body. Once you get a felt sense of safety in your body, then you've got something to work from. And I think that's the issue, is just getting, because a lot of us with anxiety, myself included for many years, never felt safe. You'd have episodes where you'd be feeling pretty good. You'd be out with your friends, new relationship, like this kind of thing. So it's a bit of a distraction, but after the things kind of come back down to normal again, you're stuck with the same old anxiety. So it's really, making friends with that part of your body that's holding all this old trauma. And like I said, that's not all of it, but there's certainly a great deal of it, there. And if you don't deal with the underlying trauma that's stored in the body, the unresolved stuff, it's just going to keep resonating through your mind. And they're doing a thing in the States now called a stellate ganglion block with the combat vets who come back with PTSD. And what a stellate ganglion block is they put a needle in your neck and they freeze the sympathetic fight or flight energy, the autonomic nervous system, as it comes up from the body. And within a minute, these guys feel like their anxiety is gone, right? So if anxiety was only in your mind, why would cutting off all this negative or this fight or flight influence from the body, why would that shut off their anxiety?
Great point.
Because anxiety is mostly held in the body. So we're chasing our tails with this constant focus on CBT, ACT, and I'm not against these things. I'm not. But it's just like they are not going to fix a chronic anxiety problem. If you've got, acute anxiety that comes up from some life event, CBT is great. But if you've got chronic, long-standing anxiety that probably came up from childhood trauma, CBT is going to be a Band-Aid. It's not going to, at least that's what the studies are showing us, that it helps for about the first sort of 6 months or so, and then slowly people kind of go back into their old patterns. Because, our psyches are kind of like, I like drawing this analogy of, if you go down if you have a fresh snowfall on a hill and you go down on a toboggan, First time you go down, it creates a bit of a groove. Then the second time you go down, it creates a little more of a groove, same place. Then the third time you go down and you go faster and it grooves a little deeper every time. Now, if that is your pathway for anxiety, if that's your habit of worry, if that's your habit of just constantly ruminating over things, chances are when you get stressed, you're going to go right down that same pathway again. So going into the body gives you a chance of making a different pathway in the snow, so you don't have to follow that automatic, grooved, replicated pattern in your mind and body over and over and over again. Because once you become aware of it and you're aware that you have a choice, hey, you know what, I'm feeling anxious right now, like we were talking about a few minutes ago. Put your hand on your chest, really say, this is me. I feel myself. Am I safe in this moment? Bring yourself into the moment. Use sensation. Bring yourself into the moment and focus on that and realize that your mind is going to try and suck you back into thinking. Because your mind's like in the corner going, hey, the answer's over here. And it's not. Like, your mind is always trying to seduce you into thinking that it knows the answer. And it doesn't. It's actually making you worse. So it's kind of like drinking seawater to quench your thirst. Initially it might feel wet and that kind of stuff too, but eventually you'll wind up peeing out more water than you're taking in, and it just creates a vicious cycle. So you just keep creating more worry, and the more off balance you become, the more likely you're going to go back to that worry. So you're going to stay in that groove in the snow, and you're going to stay in it unless you change it. And one of the best ways of changing it is, do cognitive therapies as well, but do something for your body as well. Move, breathe. The other thing that's really important, and it's starting to show up in neuroscience now, is the effective movement. A lot of us with anxiety, when we were younger, were held either physically or emotionally. Some people were, physically abused and that kind of stuff, and they were held down. And I felt kind of pinned to my house in a way, because my dad, when he would go through these episodes of real deep depression, I didn't know what he was going to do. I didn't know if he was going to kill himself or whatever. So I felt chained to the house. I felt like I couldn't. My mother was an RN. She worked a fair amount. So I was the one that kind of, hung around and made sure he was kind of okay. So in a way, I was held immobile in that house. So just movement is huge. And if you look at the somatosensory cortex in the brain, how that affects how you think, and just how it gives you a better idea of being in the moment. Like, the more you're in your body, you're in the moment. And people say all the time, like, get out of your head, because your head, it's just airhead in there. Like, there's no grounding in your thoughts. The grounding is in your body. So find the grounding in your body. When you feel anxious, focus as much as you can on sensation, because that will take you out of that old groove in the snow of chronic overthinking. And it's so compulsive and it's so addictive, because your mind is actually telling you, look, thinking is the solution. So you think, okay, well, I'll just keep thinking. And it's actually more and more of a problem. And I'll tell you one quick story. Before, I had a patient come in and see me years ago, and he said, Dr. Kennedy, I'm so anxious and I'm so depressed. And his wife had just died. And I've got to dig myself out of this hole. And I said, well, you can't dig yourself out of a hole. When you're in a hole, you have to stop digging. And digging is worrying. Digging is staying in your mind. So the more you're in your mind trying to figure this out, the more you're digging. And unless you have any new information to what you're worrying about, not only is there no point in worrying, but you're just creating that deeper and deeper and deeper groove in the snow, to the point where you're not ever going to be able to break that. The groove is going to become so deep, that's the way it became with me, that there was no way of getting out of it on my own. So the way to get out of it, without a whole lot of therapy and that kind of stuff, is to really focus on your body. Like, do things for your body. Self-care. People with anxiety are not that great at self-care, because I think Gordon Neufeld, one of my mentors, he's a developmental psychologist, and he talks about all anxiety is separation anxiety. So, the lack of attachment that you didn't get as a child gets stored in your body. And that lack of attachment keeps feeding the worry. Like, you keep wanting to connect, but you can't do it because you're afraid on some level of connection. For me, I was afraid of connecting with my dad, because when I would connect with my dad, he would go crazy, and then I would lose him again. So after I did this about 5 or 10 times, where he'd come back, he'd be on a new medication, he'd have a new psychiatrist, he'd feel better. I think, okay, I got my dad back. I would go back into full loving him again, and then he would lose his mind again, and then I would lose him. Where at the point sometimes he didn't even know who I was. So in my mind, I learned this: don't love, because love is just going to lead to pain. Now, love is the cure to anxiety. Love and connection is the cure to anxiety. So if I'm afraid of connection, of course I'm going to be anxious. And virtually all of my chronic anxiety patients have some element of this in their childhood, unresolved trauma, that they're afraid to trust love, essentially. So love is what you need to heal from anxiety, yet you're afraid to trust love. So where are you? Well, you're anxious. That's where you are.
Well, I truly believe that the medication is not the only way, because if it was, in the past 20 years we have developed many medicines, but yet we are even sicker than we were 20 years ago as a population. As you know, North America, we are much sicker now than we were 20 years ago.
Yeah,
So
absolutely.
in saying all that you had mentioned, especially when it comes to chronic anxiety, sometimes people almost get used to it. And the tobogganing example that you used is amazing, because everybody just hits the same path.
Exactly. And especially when you get stressed. So if things are going semi okay in your world, then you'll get some sort of I don't know, issue at work, or one of your kids gets sick or whatever, and you can kind of handle it, because you're feeling okay. But once you get too much stuff, that you'll get knocked back into that old groove. Because here's the thing: a lot of times when we're younger, worry has the appearance of being helpful. I tell you another story. When my mother used to work at the hospital that was very close to us, it was only a few blocks away. So she would often work the 3 to 11 shift. And I would, I'd be like 12, 13. I'd be waiting for her to get home. I used to be like a night owl as a teenager. Still am. And so if she wasn't home by 11:10, I would really start to worry. And if she wasn't home by 11:12, I would the stories start to ramp up. It's like, oh, maybe she got sidetracked by one of her patients or whatever. And then it comes into something like, well, maybe she got hit by a car, right? So I get all this worry, and then I hear her key in the door at 11:13, and I get this huge rush of, oh my God, everything's okay, she's home, that kind of. Now, what was I doing immediately before I got that rush of positive chemicals? I was worrying. Mm-hmm. So in a way, we are conditioning ourselves to worry, because we do get some sort of hit from it. People say, oh, worry does nothing. We get a hit from worry. We get an actual. So if you're a child and you worry about something and it doesn't happen, now consciously well, yeah, it probably had nothing to do with worry, but unconsciously, where all our programs are stored, we make this connection that it didn't happen because I worried. And then we become afraid not to worry. And we start using worry as a coping strategy, which is what it is, which is the biggest problem I have in helping people with anxiety, is that they don't want to release it. Consciously, it's like, I don't want this anymore. This is horrible. I hate this feeling. But unconsciously, where all your programs are, they're like, this has been an old friend to me, this worry, because, in the past, it's given me a little bit of a hit. It gives me something to do. It distracts me from the pain that's in my body. So worry does a lot of things. I just released a 5 episode series on worry on my Instagram, which is the Anxiety MD, at the Anxiety MD, all one word. And it's also on my Facebook too. And they're short. They're only about 4 minutes each, and there's 5 of them. And it basically outlines what worry is, why we do it, and why we're so addicted to it, and why we just, like, people just say, who don't have anxiety, well, just stop worrying. That's all you have to do, is stop worrying. But we feel that in the back of our minds, this worry is helping us. So why would we stop doing something that we believe unconsciously is helping us? And that's my biggest barrier in helping people get over anxiety, is on the surface, people say, yeah, I don't want this anxiety anymore. But deep down, where all our programs are, It's like, yeah, there's some part of us that believes that that worry is helpful. So I'm trying to get you to release something that you believe deep down is helpful. How do you think that's going to go?
Not good.
No, no, because overtly, and that's what I see with people all the time. Like one of the things that I do is I do like intuitive um, readings on people. And now, as a medical doctor, I kind of want to have a bit of a seizure when I start talking about that. But I realize that what happened with me when I was younger is I got really, really good at reading my mother and reading my father and giving them what I thought they needed. Right? I got really, really good at reading people, and it made me a fantastic physician for sure. Because I when someone came in, I could tell within like 5 minutes of talking to them if their problem was actual physical, if they had like a tumor, or if they had diabetes, or if they had some physical thyroid issue, or this was a psychological issue. And not only could I see what the psychological issue, that it was a psychological issue, but often I would get kind of, I hate to use the word visions again. I want to have a seizure when I talk about stuff like this. But I would see in their past, I would see that they've been abused somehow, physically, emotionally, sexually. I could see it in my mind. So it was like I knew that's where their problem was. And I do that now when I work with people now. I can take them farther in probably 8 weeks than their therapist has taken them in the last 8 years, because I see where their problem is and I see what they need to do about it. And it's always connecting with the body. It's always old trauma that hasn't come up yet and they haven't realized. They do have a sense, though. They do have a sense of where it is. And then we go into it, and then we resolve it. And then once you resolve the issue in the mind, just like the stellate ganglion block, once you resolve this energy that's held in the body, the mind doesn't have anything to do anymore but be itself. And that's what that thing about the stellate ganglion block. When you block all this negative energy from the body, you'll see these vets, these combat vets, and the families will say, he's not drinking anymore. He's connected. He comes down for dinner. He takes us out to, like, we have him back. So it shows you this tremendous amount of energy that we hold in our bodies. And again, as a medical doctor, we want to attribute this to the brain. And the brain has a tremendous number of pathways that hold memories, that hold old distinctions, that hold old traumas. But it gets resonated, the reservoir is held in the body. And this is another little story that I like telling. It's a way of explaining it in a way. It's like, say as a child, just for sake of argument, your brain can hold 1 cup of trauma, right? So as a child, you hold 1 cup of trauma. So you lose your dog, a couple of things happen in the family, maybe your uncle gets sick or whatever, but you've got 1 cup of trauma, and as a child, you can hold that. Now, say your parents get sick, or you have an addict for a parent, or you are somehow emotionally, physically, or sexually abused. That's more than 1 cup of trauma. So they put the first cup in, and then they put the second cup in. It overflows, and then that overflow part gets stored in the body. Now, if you don't deal with that overflow part, and you constantly look at trying to fix it through the mind, you're never gonna fix it. So that's why, patients, when they come and finally see me, it's like, I've been doing therapy for 20 years. And it hasn't helped. And it's like, well, yeah, because we're not actually dealing with the underlying problem. And then other people are on antidepressants. And here's the thing, I don't have a problem with antidepressants. I think they're life-saving in a lot of cases. But here's the thing, is like, when you give someone an antidepressant and it works, people don't want to go back and deal with the fact that they were, beaten by their dad by the time they were from 7 till 11. They won't have to deal with that. So they live life in this kind of numbed out, semi-lifeless place where they're just getting by. Like, they're just getting by, because they don't want to go back in. And I can't blame them. Like, there's some people that I've seen that have got such trauma that it's almost like, unless you're really, really prepared to deal with it, it's going to be too hard to kind of go in there and do it, and maybe you should just stay on antidepressants for the rest of your life. So some people just have so much trauma that it's really hard to clear up. That said, I've seen people with severe trauma who are really motivated, clear a lot of that stuff out and start living their lives and becoming the person who they really are, because they're not weighed down by this old emotional trauma that keeps cutting them down into the same groove in the snow.
Well, The issue is that just to bring another example, as our body basically having the positive feedback with the mind is apparently lately they have been discovering that when they put the nerve impulses into the cranial nerve 10, vagus nerve,
Yep.
anybody who has had depression that the medication is not helping have had quite a bit of a positive effect, and basically the depression has been resolved.
Yeah. I mean, and they're starting to do like oral stimulation, ear stimulation, like the branches of the vagus nerve that go to the laryngeal nerve, the recurrent laryngeal nerve that goes, which is part of vagus nerve 10, like cranial nerve 10. So, which is the biggest, the vagus nerve, it's called Vegas because it's wonder, it's not like a Las Vegas nerve, which is a completely different nerve, and it involves drinking and all sorts of other stuff. But the vagus nerve itself is the biggest relaxation nerve in our system. And if we can tap in to start using that, and it's exactly what I mean, because I think what happens is that it actually starts relaxing your body. When you stimulate the vagus nerve in a certain way, it relaxes your vocal cords. It relaxes your facial muscles. When you see someone who's anxious, their facial muscles are all tense. So there is something called the social engagement system, and Dr. Stephen Porges, who invented the polyvagal theory, talks about this. And it's about the way that the vagus nerve innervates the face, and the social engagement system involves tone of voice, body language, and facial expression. So if you see someone, they say, well, that person looked white as a ghost, their facial tone drops. And that's what happens in depression. Their facial tone drops. And then when you see someone with that kind of facial expression, the only place in the human body where the skin is actually attached to the muscles is in the face. And the reason why is so that we can communicate with each other. So when someone is anxious or depressed, their face drops. And that gets affected by the vagus nerve. So if the vagus nerve is stimulated in a positive way, their face starts to raise a little bit. Their voice, the laryngeal nerve, gets a little more calm. So the resonance in their voice is a lot softer. And you feel differently around them. When you're around someone who's really tense, you tend to get tense too, because we match up with the other people's nervous system. Whoever's nervous system that we're beside, we're going to connect with that. So it's a matter of just really understanding that, yeah, we can use the vagus nerve, we can use the parasympathetic system to calm ourselves down. Now, that is great, and it helps for symptomatic treatment. But if you're holding old trauma in your system, stimulating the vagus nerve may actually help you deal with it when it comes out, but it's not in and of itself going to fix it. So that's why, things like, breath work and that, which are all great too, but there is this feeling that if you just relax and you let this energy just come out through breath work and that kind of thing, that it will just automatically heal. And I'm not so sure that happens. I think it depends on the level of trauma. It depends on your level of sensitivity, because some people are just much more sensitive than others. They hold on to trauma a lot longer. So you really need to use as many things in your armamentarium as possible. So absolutely do breath work, but do therapy as well. Like I see so many people going, oh, I'm only gonna breathe. I'm only gonna meditate. I'm only gonna meditate for the next month, and expecting meditation is going to, clean out all this old trauma. Now it may help, but I think you actually have to have some kind of what Daniel Siegel calls coherent narrative. You have to have some sort of story in your mind that makes sense of what happened to you as a child. And I think breath work helps facilitate. I think it helps it come out. And I think it helps calm the body after. But I don't think just getting into this meditative state that these traumas are going to heal on their own. Or if they do, it's going to take a long time. And why not use both? Like that's my whole thing. Why not use both? Use the body and the mind if you're going to heal from it.
I mean, if relaxing and trying to meditate, it would have worked, they wouldn't be anxious to begin with because they knew how to relax.
Pretty
So,
much. And
well,
I don't want to interrupt you, but I really have to get this point in. That's why people with anxiety hate meditating, because what happens is with anxiety, there's part of you that wants to worry. right? There's part of you that's compulsively worrying because you believe that it's helping you, right? So if I sit down and I meditate and I don't allow myself to worry, I'm cutting off this potential strategy of helping me. So that's why I find that people with anxiety really don't like meditation. Now, that said, if they can stick with it and they can learn how to do it and they do it on a regular basis, absolutely it helps them. But initially, I find people with anxiety have a tremendous difficulty in just stilling their minds.
So, uh, Dr. Kennedy, if I came to you and said, listen, I'm here to get treated,
Yeah.
anxiety, what is it that you do for me and how do you do it? And we will go through the steps and we will have the information for our viewers where to find you, so at least they will get a glimpse of what you do.
Sure, sure. Well, I would go into your family history first, usually. Um, what was, go back to your grandparents. What did they die of? What was the stresses that they went through? And that I sort of get a picture of what your family looks like. And I get a tremendous amount just from that, because so much of our traumas are intergenerational. My friend Mark Willin, who wrote a book called It Didn't Start With You, talks about this, about how our traumas are kind of handed down, and unless we resolve them, we hand them down to our kids as well, and it just keeps flowing through the family. So I would look at that. I would, this is where it gets a little flaky. I kind of read your energy. I kind of sort of see. I talk to you about, one of the things that I say to people is, especially the people that have a hard time finding their trauma, I'd say, okay, if I gave you one wish or a magic wand or whatever you want to call it, and you could fix one thing about your childhood, but only one thing, what would that be? Now, for me, that would be my dad. I would wish that my dad wasn't sick. So I can extrapolate from that probably, not always, but probably the major trauma that is stuck in me is the trauma that's left over from my father. So there's a bunch of things, and there isn't sort of a kind of a step-by-step process that I use. It's very individual with everybody. And I basically read you, and I kind of see what's in you and see where your blocks are, and then we talk about it, and I say, well, what about this? What happened to you? Or I'll say to you, like, what happened to you at, 12 or 13 that changed your life, And so I might ask you that, like, Kevin, what happened to you at 12 or 13 that changed your life? And what would you say?
To be honest with you, I was just going to tell you this, that I never thought I had any trauma. And, obviously we migrated from Middle East to Canada. It was in 80s, and we had religious prosecutions and much difficulty that goes with it. And I always thought my skin was as thick as an alligator and I was good. Till about 6 years ago, my brother unfortunately had a poolside accident where he became quadriplegic. And this flood of emotions, and I mean emotions and backflashes that came out, I didn't know where they were coming from, but they were just pouring out.
Right.
It was like this trauma opened the gate to everything else that was stored in there.
Yeah. And I see that a lot. Because it takes a tremendous amount of energy to hold that stuff down. How old were you when you came to Canada?
I was 16.
16. Okay.
Yeah. And the issue was that anyway, I was just trying to say that even in myself, not knowing what it was, all of a sudden I'm having a year and a half of difficult sleeping, nightmares, constantly feeling of this guilt for no reason.
Right.
And how I tried to deal with it was basically to talk to my brother.
Yeah.
At that time, us both connecting and reconnecting and trying to make light of the very difficult situation, I think gave me a second wind.
Yeah, it does, because you get some resolution in that. Because, and this is where neuroscience kind of comes in. There's a structure in the brain called the hippocampus. And the hippocampus is a very integrative structure. It has fibers that literally go to just about every part of the brain. Now, sometimes when we experience traumas, the way I kind of explain this is, say the trauma of, coming to Canada was stored in maybe one part of your brain, right? and you were able to kind of hold it back. It had a fair amount of energy to it, but you were able to kind of hold it back. But when this happened with your brother, you weren't able. The resources that you had that were holding that down were now occupied in trying to deal with the trauma of his loss and dealing with that. So this all of a sudden now becomes exposed. And what you did when you started talking with him was you started engaging different parts of your brain, different memories, different coping strategies. So the area there that was kind of this glowing hot red spot that you were kind of suppressing is now shared among different regions of your brain. And that's called integration. So when your brain integrates these old traumas, you have a chance at that point to take a lot of the charge and the energy away from them, because now the load is shared rather than just in one part of the brain that's holding it. Now, it's held in the body too, so it's kind of a schematic kind of way of looking at it. But it's the more parts of your brain and your body that are involved in working through that, and they become congruent, and then your mind and your body become connected with that, the less energy that creates. That when a similar situation comes up, the less energy that creates, and then the less energy that creates, and you don't get shoved down into that groove in the snow anymore.
Well, there's topics that I like to discuss with you are numerous, but unfortunately, I do realize that we have a time limitations. So please let our viewers know where we can find you, your email address, your YouTube and Instagram handle, and everything that if they need to get a hold of you, how can they do that?
Yeah, if you just Google the Anxiety MD, I'm really easy to find. Just those 3 words, the Anxiety MD. And YouTube comes up, my website comes up. You can certainly email me through the website. That's the easiest way to find me is just Google the Anxiety MD, and tons of stuff comes up. And you can just you can look through my YouTube stuff, my Instagram stuff. And right now I'm not trying to make a business out of this. Like it's really my mission that people don't have to suffer like I suffered. I have so much information now, and then dealing with this condition myself, I really know, being a physician and a neuroscientist who also has the problem, I'm able to see what the solution is, because I know what works for me. Not saying that what works for me works for everybody, but I've certainly had a lot of success in using these strategies that I've used on myself to help other people. So it is one of those things where I think, I really want to help people. At this point, it's not something that I'm making a business out of. I really want to serve. I really want to help. Eventually, it probably will, down the road become something like that. But at this point, I really have this thing almost in a way to kind of reconcile with my dad in a way, because, I went through so much pain with him that I don't want other people having to go through that same pain anymore. So I want to put out as much content as I can, help as many people as I can, which means I don't work on one-on-one so much with people, although I will in specific cases. But I just create more and more content. I'm finishing a book now called The Anxiety RX, which I think has a lot of my views on the way that anxiety is looked at, because it's being written by an MD. I'm a medical doctor and a neuroscientist. So it's not something that they can kind of go, well, this is out there. This is kind of woo-woo or pseudoscience or whatever. It's like, look, I've got the condition. I know I went through regular allopathic treatments for a long time. It helped a bit, but they really didn't do it for me until I, did some ayahuasca and did some LSD and that kind of stuff, not to get high, but just to examine, to get outside of my brain and kind of really look at, what exactly is happening here. And the stuff that I found about anxiety is very counterintuitive. Like, I'm worried to keep doing it. So yeah, if you Google the Anxiety MD, I'm pretty easy to find. And yeah, I'd appreciate your support. I'm trying to get this thing launched and going, and I'm trying to get a name for myself, and I'm trying to go out there and really show the medical profession and the psychiatric and the psychologists that there's a different way. There's a different way of going at anxiety rather than just sitting and talking about it. Because that's helpful. But you really need, if you had two divisions, armored divisions, and you're going into a battle, one being the mind, one being the body, why would you just use one? Like, why wouldn't you use everything at your disposal to help you get better? And again, that last thing is that a lot of times people don't want to get better. Like, they do, but they don't, because it is one of those things where they are, their worry is actually giving them this false sense of security. And so we have to slowly give you something else. And what I do is I get you to lean on your body. And then once you feel secure in your body, then you have somewhere to go. So I'm not just taking away your coping strategy. I'm giving you something else you can do so you don't feel bereft. You don't feel like you've lost your coping strategy and now there's nothing. And now you're just faced with the worry on yourself. Just that, am I safe in this moment? Just that alone, saying to yourself that, and really having that felt sense of safety is for a lot of people, say that's the best thing they've ever heard as far as anything that I've ever done for them. So again, I tend to babble and that kind of stuff, but I'm really passionate about really putting out as much content. And so if people can support me, I would really appreciate it, because the more support I get, the more the more exposure I get from bigger and bigger sources, and the more I get a chance to sort of say what I need to say to the world.
Well, Dr. Russell Kennedy, we do appreciate your time, and we are grateful that you dedicated this time for us and definitely for our viewers. I'd like to extend our gratitude and gratefulness for what you have done and you're about to do, and all the content that you have on your website, on your Facebook, free of charge for patients and people to look at. At this time, the time is short, and I know you're feeling a little under the weather too. So if our viewers could give us a like, give us a heart, share as many times as you like, we would appreciate it. I thank you, Dr. Kennedy, for joining us today. I hope you get better soon, and I bid you goodbye till the next time.
Thanks again.
Good day.